After a meeting with key stakeholders, Dr. Eva Jenga, the representative for the CS Health Sicily Karaoke, was now ready for a tree planting session within the university. But hey, she had to be welcomed in style. And this is how it's done at Mount Kenya University. A photo session couldn't be sacrificed, especially with such an important guest. And by the way, when you receive an important guest, please have them sign the visitor's book.
Have the honors.
That's great. You're walking the talk. Environmental health. Yes.
Yes. Very good. Thank you so much. We can clap for her. Wonderful.
This I have done before.
Yes. It's in the blood.
Yes, it is my genes.
Let's continue clapping for her. Thank you. Wow.
That's enough. I have actually done my exercise for the day. I've exercised. Make sure it survives.
A clap for her. Wonderful.
Women's Day is a community of Accredited. I could borrow this. It's nice. I think it's quite a comprehensive library.
Yes. Apart from this, we also have actually.
Yes. Everybody can download this. The Google is from everything. Yes. That's what I was trying to look and see.
We also have a lot of whereby students can be able to access online books. Yes, we have of them. We have subscribed to online resources.
Madam asked you about environmental health. Show us a few books of it. This is what we need, yes. This is what we are looking for. It's not actually related to what we are coming to do today.
Okay, very well.
you are persuaded.
Some of the faces. This is the team from the Public Health Council.
Yes.
Are you ready for it?
Yes.
Right, let's see what you see there.
You captain.
Make sure. Let's appreciate her. Let's appreciate her. Let's appreciate her. Let's appreciate her. Thank you so much.
Wow.
And you can have the honors, the first honors of telling us what it is written on.
So, Mount Kenya University, this environmental health skills laboratory was officially opened by Honorable Cicely Kariuki. I'm doing it on her behalf. Cabinet Secretary, Minister of Health, on today, Friday 26 July 2019 at 10:50.
Wow, let's appreciate that. Thank you so much. We can now proceed to the ribbon and then have a look at what it is. Thank you.
Laboratory officially just open.
Wow.
We have different types of bin liners so that the person who is taking waste will know this bin called color code, will know this is infectious waste. With the red one, that is danger, so that is high infectious that can transmit diseases. Yes.
And what's the use of this one?
This is the safety box that we use sharps. You cannot combine the waste because of disposal.
How do you dispose the chaps from here?
From now here with the Minister of Health, level 5, we take our waste at level 5.
Do you know how it's done?
Yes.
How is it done?
We do incineration
Where? At what point?
at level 5.
Exactly. Which hospital are
We
you
need
using
our
for?
public health officers to know the CAP 242 and CAP 254. That CAP 254 regulate food, drugs, and chemical substance ads. In public health, though, it's when you want to enforce law for those people who are not complying with the requirement as per stated in the CAP.
So which one of these are you using for the red alert?
CAP 254.
Is it? Have you actually implemented this?
Yes.
Good. Have you been to the field to do this?
Yes.
Where have you recently been to?
Here in the Thika town.
Oh, yeah.
In
Did
the
you catch
supermarket.
anybody?
No.
So Thika, you are safe.
Yeah, we are.
Okay, I would like to know about your nutrition, a little about nutrition assessment. I work with non-communicable diseases.
Yes.
I'm seeing you have a scale.
Yes.
So are you dealing only with children or also with adults?
We're dealing with both adults and children,
Okay.
whereby we know a mother takes a kid to MCH. We need to get to weigh weight, and we see the mark. We use the mark to see whether the child is malnourished or not. For the adults, they need to take their weight, and they use the stadiometer. We calculate the BMI.
What is the importance?
The importance is that we need nowadays the obesity is very high and overweight. So we need people to know their weight and their height, and we advise
I'm
them.
hoping you are doing a research, especially in this community, to fight the level of obesity.
Yes.
Because you know you reverse that and you're going to reduce the non-communicable diseases.
Sure.
So the people in your lab should be maybe collecting data. So Prof, I'll be very interested in how you're collecting this data. You say you're going to community and doing all this. I'm hoping there is some structured way of collecting this data, and you could actually publish and tell us how we should be able to address the obesity in this area. Because I am very, as I told you earlier, I'm very passionate about that. Yeah.
Yes, well, at this point, we need people to take good food that it's inspected and meets the requirement as per CAP 254. So we inspect food and we see all the standards and nutritive value is well indicated. Yes.
Tell me the nutrition value from this one's closest to me.
For that, alcoholic drinks, then we have non-alcoholic drinks.
And they're all foods. They're all foods.
The
They are all
beverages.
foods.
Yes, all the food.
But as you go to talk to, I'm hoping
Yes.
we are talking, you talk to the community.
Yes.
Do you tell them also the harmful use of the harmful excess use of these things?
Yes, we tell them about alcoholism. If they engage themselves in alcoholism, which are the impact in the community, the diseases they will get after taking alcohol, the responsibilities they will have to their families if they are alcoholic. Yes.
I've seen you have written there expired. So, because you are talking about food safety,
Yes.
so we expect you to tell us how will the community know that this food is safe and that this one is not safe for human consumption.
Yes. So for example, this one, we are those standards at the CAP 254. So for expired goods, we tell them how to inspect to check the date of manufacturer and the expiry date. Then they see the nutritive value. Is it well indicated? Are there additives that are there? So that they can be able to know whether it's good.
And the current food challenges in the country in terms of whatever the meat or anything else.
Yes.
The students, how do you take the students through, for example, the sampling procedures for the food?
Yeah, we have a sampling form here with us. When the student or the practicing public officer goes to field, they need to do sampling. So once they move, like if packed goods, they can use, in public health we say M diagram. So you draw an M diagram whereby you pick different randomly, so that you can be able to combine them and have a sample, a uniform sample that you can take to the lab for analysis. In case of complaint from the community, or you at your level, you doubt that commodity is fit for
So,
human
how
consumption.
do you ensure that the sample taken is a true and reflects the picture on the ground, is a true representative of the situation on the ground when you sample?
So we always advise you take not less than 2 kgs to the laboratory.
How often is that?
We do routinely or in case of complaint or an outbreak.
What does routine mean?
Routinely say monthly, or according, maybe in this sub-county we take monthly, after 3 months, quarterly or annually.
So I presume MKU is covering thick and you are being trained to go to other parts, other counties.
Yes.
Do you ever venture outside this area where the university is situated?
No, we work at your area of jurisdiction. You can't go past your area of jurisdiction.
Yeah, but I wanted to hear maybe what the MKU has to offer
Yes.
as far as, for example, food sampling is concerned. The support of the university in the community around. Yeah, what's the impact of the university as far as this is concerned? So because this is a big area now, we have a problem, and if the university does not come to play a big role, then we'll be failing as an institution and as a country.
Absolutely.
Thank you. Maybe I can come in at this particular point. Mount Kenya University has the capacity. We are building capacity right now to be able to accredit, to have our lab, our research lab accredited, so that the result that we release will have authority. As at now, the facilities that we have, even if we release the results, they are not authoritative enough. Like we have the capacity of doing water quality analysis. Like we've been having issues with heavy metals, so we have AAS. As in, we have capacity in the university, both the human resource and machines. But we must have our lab accredited. So right now we're in the process of having the lab accredited, so that the result that we release, we can be able to brag and say that this is the result and this is what is real on the ground. But as at now, the process is ongoing for accrediting our labs.
There's such a disconnect. There's a lot of information that is really just confined to maybe the cafes. A lot of stories that are a bit alarming, but there's no flow, there's no connection, such that every player is having their own narrative, pursuing their own agenda. So now that we are having and engaging in this discussion, and as we take this discourse, when I see, for example, like such products here, and then some of the stories, they are uncertain, they are not really being confirmed. When we look at, for example, the soil issues, that is not coming from the agriculture. For some of these issues we are saying that are major, they are emanating right from the soil composition. But there's such a disconnect. And that is why we are saying, like in the health department, we are stating, we are very happy that this is happening in NKU. We would wish to see, like what you are saying, can we get all people and we have such a flawless flow and a connection if we are to succeed in as far as food safety is concerned. So the Ministry of Health is working in Kiambu County closely with the Ministry of Agriculture. We have those programs and we need other players. There are so many that are involved in food safety, and I think the project now you need to come on board and you see what you want.
Can I just maybe let you know that there's no way one stakeholder is going to solve our crisis in this country. And until we realize that health is ours, and somebody said earlier as we had a meeting in the morning, One Health, it's all of us. All stakeholders must collaborate. And that's why even the national government has the NCD strategy with an ICC committee now to intercoordinate all the stakeholders so that we all speak with one voice. Because when you hear one from this side, the national government, the county government, you think we are serving different countries, but we are in one country. And if we all agree, and this is why evidence is so important. This is why you need research. You said you want to be accredited, but you only be accredited if you come with proper written out research proposals, and actually you give us the way you are doing your research and the analysis. You say you have machines. We also need to know all those steps of analyzing the things that you are sampling. Then this, even as they get published, that's how you get known. And they say usually you either publish or perish, so you need to publish what it is you are doing. And I want to echo Dr. Kariuki, yes, community health is very key, going to the communities. But documentation of what you are doing is what will actually hold you accountable. Otherwise, you can go all over the country, but nobody will ever know you are there because you have not recorded it. So we need to document this. And the obvious now we have coordinated data in health and the Ministry of Health. Everybody needs to know, and this is why you are saying, yes, what impact shall we make for our country? And even within our own community, we start from where you are. We say charity starts from home. So then start from Thika, and then with all the specialists that you are going to graduate from here, then you can
to field, you need to have sterilized sampling bottles and the requirement that you need when you move there.
Now we have along the highways. You see so many people selling. Have you actually tried to sample this to see whether they are safe for the people, for the community?
Yes, currently we have sampled one of the water. We have our public health officers here in the field, so we are waiting for the results.
Because that would be very important,
Yeah.
especially I think highway.
Yeah.
Oh.
Actually, it's in the country now.
Yes, yeah.
And that's why we're asking whether the universities know that. Each of those areas we are taking us
Yeah,
to.
yeah,
The community here is consuming water from very many sources. We don't know where.
yeah.
But the university can listen the alarm. Maybe the officers in the field may not have the techniques and the equipment that you have. But you can actually raise an alarm. All this, your community is taking. And of course, you will be able to recognize the input of the university as far as public health is concerned. Because it's not one player. When there we were talking about multidisciplinary people coming together. Because that's what we are working, especially on the food area. Even this is another food area again, where we work with the COG team, ourselves, and many other government agencies to make sure that if it is a water issue, what are we doing about it in our country? But we cannot abdicate the role of public health department as far as water consumption is concerned. Is it safe for human drinking? Is it safe for Kenyans? I think that's what we are talking about.
And when you have the facts, you have another stakeholder who is very important for the state.
Yes.
These are the people.
They will support.
But the problem is also we sometimes have become alarmists. So some of the things that we are saying out there are wrong. So this is why I keep on saying, get evidence first before you speak. And before you post it on social media, because you're going to cause a lot of chaos, panic attacks. in our community by putting in there that are not actually supported by science. So
Now,
make sure things are supported.
We have seen there are so many equipment here, and these are very modern equipment. Maybe the best the university can do, and through the CEO, Professor Audo, and the Dean, is to indicate what type of tests are being conducted here, and let them be able to tell, for example, our colleagues in the field that we have the capacity and the technology to be able to undertake the following test. And this will save both the county government, the national government, a lot of revenue, a lot of money. For example, you don't need to take specimens, for example, water samples here to national public laboratories, and maybe if the university is accredited, and then this becomes center of excellence in testing and determining the quality of the food article that is subject. And then again, to ensure that you reassure the community that what you are doing is good, because this is very nice, and I want to hail the CEO. This one is well. We have been coming here, but we have seen tremendous effort, and this is very, very important. So the kind of test that your institution can be able to do is not only meant for teaching. The way our chief guest has said, it's meant to conduct researches, but also to attract other stakeholders. But the main stakeholder here, we are safeguarding and protecting the community. Therefore, can the university come forward and say we are able to do 1, 2, 3, and hence the community can get access to these services.
Thank you so much, MC. The guest of honor and the chair of the Medical and Practitioner Board, Dr. Eva Jenga, the CEC Health, Kiambu County, Medical Superintendent, Kiambu, Thika River 5, Registrar of the Board, Fortec Board, the Chairman of the Board, Council Member, Dr. Jonge, other members of the Board, VC, DVCs, Registrar Academic, Deans, members of management, and invited guests. Good morning. Mine is to welcome you to Mount Kenya University this day as we celebrate a very good success that we are enjoying today. Let me start by saying that this journey we have walked for a long time. I think this is the longest journey we have walked in regards to accreditation, and that is why we are very, very much honored to have you today as partners to celebrate with us, because to us is a big milestone. As we celebrate this day, we want to assure you that you are in the right place. You are in the largest private university in Kenya, one of the most committed in terms of assuring quality. And I think members that are here that are from various boards are aware and can confirm that as a university, we are very, very much committed and very, very, very willing to work with the board. So feel very much welcome. Let us celebrate together. We are celebrating success of our future, of our children that will go through this curriculum, and as Kenya as large, because we know the issues that are touching to our health. They can be arrested if we were to do such program like BSc in environmental health. So feel much welcome. We are ready to host you today, and we have all the facilities that you may need here in Mount Kenya University. Thank you very much, and God bless you.
A round of applause kindly for her. Thank you so much. We love visitors in Mount Kenya University. Actually, we are the best in loving visitors. And our students plus my fellow staff members, kindly let's give them a standing ovation. Kindly, a standing ovation to our visitors, kindly, as we appreciate them. A standing ovation, kindly. Yes, this is how we welcome our visitors, and you can be sure you are much, much welcome. Thank you so much. We can take our seats. At this juncture, I wish to welcome Elizabeth Kelly, a Bachelor of Science in Environmental Health student who is a first-year student to come and make her presentation. Let's appreciate her as she comes on today.
The chief guest, Dr. Eva Njenga, Chairman Board, Vice Chairman University Council, Dr. Vincent Gaido, the Vice Chancellor, Mount Kenya University, Professor Stanley Wudo, Deputy Vice Chancellors, Mount Kenya University, Registrar Academic Administration, Registrar Public Health Officers and Technicians Council of Kenya, Dr. Kefa Umbacho, Principals and Directors, Deans of Schools, Heads of Departments, staff, invited guests, and my fellow students. Good morning. Thank you very much for joining us in celebrating this auspicious occasion today. I stand here as a student in BSc Environmental Health. Environmental health is a science in balance and defense that protects people and the environment with a focus on preventive measures. Worldwide, many people continue to suffer from preventable communicable diseases such as diarrhea is a classical example. As we get towards Vision 2030, SDGs and the Big Four agendas, there is a need for capacity building in the field of environmental health. This is due to compounded continued increase in environmental hazards emanating from the rapid urbanization and industrialization as a result of modern technological development. The Bachelor of Science degree program in environmental health aims at producing environmental health scientists capable of addressing health issues by responding effectively to deteriorating environmental conditions that affect human health with a view to proposing possible solutions, thereby enhancing good health and sustainable environmental management. I feel delighted to be in this noble cause. I would like to thank the FOTEC for their continued effort in implementation of measures geared towards quality training and also for their mandate as a professional regulatory board to guarantee excellence in regulating the training of public health officers and technicians in Kenya. Finally, I would like to thank Mount Kenya University for giving us the opportunity to pursue our career. I would also want to encourage those awaiting to join university to join us as we boast of being the first university in Kenya to be fully accredited by the FOTEC. Thank you.
That is wonderful. We can appreciate her once again. That reminds me when I was in first year at the university, that was in 2000 and something, and I don't think I could stand before such learned friends to make a speech. Let's appreciate her once again. The future is bright. Our chief guest, Dr. Eva Njenga, the chairperson, Kenya Medical Practitioners and Dentists Council, plus all our distinguished guests. It is my honor and privilege to welcome the Dean, School of Public Health, Dr. John Kariuki, to make his speech. Let's appreciate him as he comes on board.
Our chief guest, Dr. Ivan Njenga, our Registrar of Public Health Technicians Council, Chairman of Public Health Technicians Council, Mr. Kemani, representative of the chair of the University Council, our Vice Chancellor, our Deputy Vice Chancellors, the CEC Health Kiambu County, the Medical Superintendent, all invited guests, ladies and gentlemen. I'm very pleased these days to welcome all of you in this auspicious occasion where we are celebrating the accreditation of the environmental health program in the School of Public Health. Our chief guest, the BSc in Environmental Health, is housed in the School of Public Health, which has got other departments like the Department of Environmental Health and the Department of Epidemiology and Biostatistics, Department of Community Health, Department of Nutrition and Dietetics, and Department of Health Management and Informatics. The vision of the School of Public Health is to be a center of excellence in training public health research, consultancy, and community service. And the mission of the School of Public Health is to train and develop environmental health professionals with the ability to offer quality health care, which is geared towards prevention and promotion health care. Our chief guest, the program of BSc in Environmental Health was mounted in the year 2010 after approval by the Commission of University Education. With the coming in of Public Health Officers and Technical Council through an Act of Parliament in 2013, the Public Health Officers and Technical Council, in the pursuit of their mandate, they came for the first inspection of the program in the year 2016, where they inspected and guided the university towards improving the program. We are happy that since that time the university has worked around in trying to comply with the provisions of the Public Health Officers and Teachers Council, and today I'm happy to note that we are celebrating that kind of climax. Through the program, we are very proud as a university and as a school that we are now producing graduates of high quality standards who can meet any challenge in the area of public health. Our guest of honor, as a school and as a program, we are committed to ensure that we continuously improve the program of environmental health to meet the standards of HOTEC and any other group standards and any other emerging market needs. In preparing for this accreditation, allow me to appreciate the support given by the Vice Chancellor of this university and his entire management team, the Public Health Officers and Technical Council, who have continuously visited the university to support the process, and the Environmental Task Force that has been working under the leadership of the HOD to ensure compliance with all the set standards. And in a very special way, I want to thank the former HOD of Environmental Health, Dr. Susan Mambo, who started this process of accreditation within the school and the Department of Environmental Health. Above all, I want to thank the Almighty God who has seen us through all this up to this very day. Thank you very much.
Yes. I wish to take this opportunity to welcome Mount Kenya University Vice Chancellor, Professor Stanley Waudo, to make his speech. Kindly let's appreciate him as he comes.
Our chief guest, Dr. Ivan Jenga, Chairperson, Kenya Medical Practitioner and Dentist Council, Madam Mary Kamau, CCC, Health Kiambu County. I recognize that we may have other leaders present from the county. You're welcome. I also recognize that we may have national leaders present. I may not be able to name all of you. Feel welcome to Mount Kenya University. I see our good partner, Dr. Nyaga, the medical secretariat level 5, present here with us. Feel welcome. I want to mention that if there is a real working relationship between public and private, the relationship Mount Kenya University has with Thika Level 5 Hospital is working very well. Thank you so much. Dr. Njoke, who is representing Council, University Council, feel welcome. The Vice Chancellors of Mount Kenya University, registrars, principals, librarian, deans of schools, including the Dean of Public Health, School of Public Health, directors, heads of department, staff, student leaders present, student staff, ladies and gentlemen. Let me join others in welcoming our guests to Mount Kenya University, more importantly to this ceremony, which is very important in the academic calendar of the university. I want to ask one or two questions and I will answer them. One is to state that most important question is why was Mount Kenya University established? The answer to this is very simple. We are all aware that at the time of independence, 1963, we were saying that we want to fight poverty, fight disease, fight ignorance, and the story still continues. We are talking about importing maize from somewhere. We are talking about people dying because of poor care. So we realize that we still have a gap in fighting the three things that we wanted to fight right from the time of independence. So Mount Kenya University was established because there was need. That it's always said, necessity is the mother of invention. So there was need for us to establish Mount Kenya University. To our guests, maybe I need to mention just briefly the journey Mount Kenya University has taken. Before I do that, I want to give credit to the founder and the chairman of board of directors and the co-founder, the family of Professor Simon Kicharo. From a very humble beginning, we now have a university. And the beginning is such that they started a small computer outreach program in Thika. And for a while, they would not even pay rent for the place that they had rented. And then suddenly, something came and said from somewhere, you know, when you have entrepreneurial mind, you always have ideas. And you can easily transform those ideas into tangible outputs. So the idea was now to come up with a tertiary college. And they started Thika Institute of Technology, offering certificate and diploma programs. And the story is that initially they had only 2 students, but the landlord was very understanding. Said, you know, young man, you have good ideas, pay me the rent when you have the money. So it is continued. Then suddenly 300 students. So there was enough money raised to pay the rent. And then come 2006, sorry. The graduates of the tertiary college showed interest in academic progression. And of course, you know, at that time, the opportunities, particularly in some of these areas that we are offering, opportunities were very limited. So it became necessary then to establish Mount Kenya University. That is how the story started. And the first achievement was when we were granted what they call letter of interim authority. This was in May 2008. The next thing is that once you have that, it's like an interim driving license. You can drive, but you have to have a learner behind you. So we had to move forward and get full accreditation, which we achieved by getting the award of the University Charter, Mount Kenya University in 2011. And of course, after having done that, we realized that we needed now to expand in some of the areas that will help us fight diseases. And that's why we have the College of Health Sciences. Within that, we have schools like medical school, the public school of public health, and so forth. So our guest, Mount Kenya University, was established to serve a special purpose, to develop the necessary human resource that's required to help Kenya move forward in terms of fighting poverty, diseases, and ignorance. Having said that, then I would then ask another question. Why environmental health? In my previous remark, I did mention that this is going to help us fight disease. But beyond that, it's a special area of training. If I had to go back to university, I would probably train in this area. But unfortunately, I don't have that opportunity. And I want to appreciate FOTEC for the guidance and support that has made us reach where we are. Investing in science-based program is very heavy. I don't even know how we manage, but we are managing. We are managing. Having said that, I want again to welcome all of you, our guests, to Mount Kenya University. And I know someone else will pass a vote of thanks, but on behalf of the university management, I want to appreciate the chairman of the Public Health Officers and Technicians Council, the registrar, and members of the council for working very closely with us to bring us to where we are. Thank you so much. At this juncture, ladies and gentlemen, it's my pleasure to invite the registrar, FOTEC, to make a few remarks and invite the chairman.
Good afternoon. Before I start giving my talk, allow me to apologize for coming late. I think the art of being a civilized human is to be able to say sorry. I had some other engagements in the office which were so critical. That is what made me come a bit late. Now, allow me to recognize the university management by the way of our good professor, Stanley Waudo, and the whole community, the teaching community of the University of Mount Kenya, for having welcomed us here. So, the guest of honor, Dr. Eva, this is the place to be for us who are in health. And the students will recognize you. I think this is a big day for you. Colleagues who are here, and I've seen quite a number of our colleagues, and you will allow me, guest of honor, to introduce and recognize, because some of these things I cannot be doing them single-handedly. I recognize my senior colleague, Professor Karama here. I see Buana Duba, our Secretary General. Here I see the Deputy Chair, Buana Benjamin Murkomen. One of my deputies, the office, I've got 5 deputies, one of my deputies, Moreibi, who is here with me. I see the chair here, Buana Kole. I see Mr. Kitawa William, representing the universities. He's a lecturer in the University of Kabianga. I see Fatuma. Fatuma is a council member. These are council members, Kitawa, Kole, and Fatuma. I also see Bwana Iduri from, is a council member representing the counties from all the way from Kilifi. I see, who am I missing? I see the head of Secretariat, Mr. Oriema, very hard working young man, who many times is the one who has been doing all these things. Now, first and foremost, I want to say ongera to the university for having been able to achieve this remarkable award. I am aware that we are having quite a number of universities in this country, both private and public. Maybe it's the right time for us to get reminded that maybe the private universities might be overtaking the public universities. We want to say we appreciate the work you have been able to put in place to be able to meet our basic requirements, to be able to be awarded accreditation, to be able to be, in a way, we would want going forward to use the university as a benchmarking institute for other universities to run as to how you manage to do it. Of course, we have been having meetings here and there, and I think the strength of this university will be Professor Gicheru, a very interesting Kenyan, a man that you can talk to and is willing to do what you are advising. I think many of us, we like cutting corners sometimes to look for shortcuts. But when we start the journey, Professor was able to tell us what you want, and we'll be able to do it. If it is in Kenya, I'll get it. If it is outside Kenya, I'll get it. I think this is the way to go for us. The degree you are offering, that we have come here to join you to celebrate, as some of us who have talked ahead of me have said, is going to deal with quite a huge concern in this country. And globally is an area of interest because it's dealing with the issues of emerging public health concerns. Especially areas like now that we are getting the NCDs are just almost overtaking the communicable diseases. We want to address some of the risk factors that we must be able to mitigate and reduce the burden of disease. For this purpose, Kenya. But I'm aware that you are training for the globe. As a private university, I am aware that money will be an issue for you. And indeed, it's a fact that as a university, whether public or private, if you don't make money, then the university cannot be able to move ahead and over what is required. This far, even in trying to regulate your graduates, significantly we have not seen any failure in joining the market. Ours is to ask you and encourage you to sustain the gains if you cannot be able to actually do it even better than the way you have been able to do it before. We are aware that the university has got also other branches elsewhere. We as a regulating body will be able to work with you and ensure that we work to be able to remove if there are areas that are becoming an impediment so that we can have our young students access this basic requirement, education. This area, as we are all aware, requires that the students must be exposed to both theoretical and practical issues. For us to be able to have agreed and actually gone through with you and the colleagues who are working with us, we were satisfied that the basic requirements were met. And going forward, as we have shown our commitment to you, is that we'll work to ensure that the university here and the branches are able to give both the fresh students and our working colleagues who have not been able to get this kind of opportunity to be at the university to take a degree program in terms of enhancing one's capability and skills to be able to offer the service in a more informed way. So for the Mount Kenya community, the Mount Kenya University community, we want to say hongera sana, and we are here to do just that one job of awarding you the accreditation, not because maybe we liked you or because we were friends, because you deserved it and you met the requirements. So without making too many remarks, on behalf of the council, hongera, and we are here committed to work with you going forward. Thank you so much.
Let's appreciate him better. Thank you so much. At this juncture, before we invite the chairman of the council, I want to recognize the presence of departmental staff from the Department of Environmental Health. Kindly, let's be upstanding, led by their head of department, so that we see them and we recognize them. Kindly, let's put a round of applause for them. Those are the part of the staff, and we have interacted with quite a number of them. Thank you so much. May you take your seats. So much. It is with great honor and privilege that I want to invite Mr. Simon Kimani to come and give us his. Let's welcome him with a round of applause. Welcome, sir.
The chairman and the founder of Mount Kenya University, the University Council members present, I've seen Dr. Kimani here, the Vice Chancellor, our good friend Professor Bondo, used to struggle with him here so many times from 2016. Thank God that we are here today, and I'm happy to be present as well. Management and staff of Mount Kenya University, Registrar and staff of the Public Health Council. Also with us today, the Association of Public Health Officers, led by their chair, the Secretary General, and other teams around here. And also the Professor Karama from the Uma University, Head of Academic and Administrative Units of this university, distinguished guests, ladies and gentlemen, as well as our students. It gives me great pleasure to join you today for this historic occasion of granting program accreditation to Mount Kenya University, Thika main campus. As a council, it has been our mandate and duty to offer technical and professional support towards full program accreditation of all public health and environmental health programs in all institutions of higher learning in Kenya. It is therefore a privilege for me and the entire council to come here and witness the first institution of higher learning being granted this accreditation. And I think as a representative of the council, as the representative of the council was asking whether this is the first one, indeed I confirm this is our first institution, and maybe the Vice Chancellor can attest to why you have been so firm in making sure things are light, because this is where I expect other universities to come and benchmark, see things the right way, and therefore we will have the right graduates getting out of our institutions of higher learning. The accreditation for the Bachelor of Science and Environmental Health program in Mount Kenya University is indeed a testimony that partnership and meaningful collaboration yields positive results for the growth of public health professions in our country. On behalf of all council members present here and the ones that are not here, it is my belief that the accreditation of the program only marks an initial step in the improvement of quality training for public health officers and not an aid in the enhancement of adherence to training and accreditation standards. So we will continue to work closely with the university in the matters training. As I was talking earlier on, in matters research, in the impacts that we expect the university to have on this area, that will be key to us in making a follow-up in that in all areas. So those standards, we would like also to see that the impact is being felt by the community here in Thika and also out there. Ladies and gentlemen, as we celebrate this milestone today, the Council remains committed to the government's Big Four agenda, particularly in the attainment of universal health coverage through production of quality human resource capital for health, inadequate numbers as a gateway to promoting accessible healthcare in our country. However, it was noting that an increase in the health workforce alone, volumes alone, is not enough. Ladies and gentlemen, I cannot this cannot guarantee value in health services delivery on its own. This would therefore require an improved quality of professional training to produce competent, skilled health workforce in adequate numbers and to instill professionalism in service delivery as well as adequate budgetary support to reduce the disease burden from preventable causes. And I thank the university and especially the Vice Chancellor and the founder for the putting up quite a number of resources in this program. I know we could be having many demands in terms of equipment that we require before accreditation, what we expect the university to undertake. I know a lot has gone into that, but we thank God today as we stand here that you have done it right for the country, you've done it right for the program, and therefore we are sure to tell others, go to Mount Kenya University, Thika main campus, and you'll be able to see what we are talking about. So we really appreciate that budgetary support from the university to our colleagues in this particular department and this program. The accreditation of environmental health program in Mount Kenya University will therefore add to the skilled and competent health workforce based on the community level to support the delivery of universal health coverage agenda and contribute to the higher attainable standards of health as guaranteed in our Kenyan Constitution. Ladies and gentlemen, it's my hope that the university will continue to improve standards of training in the approved campus, but will also initiate the process of accreditation in all other campuses across the country that offer the program. We are accrediting this program today in this campus. You've seen the investments the university has put up in this university, and especially this area. We would wish that any campus offering this program goes through the same process so that the students graduating from any other campus other than the main campus here get the same exposure, get the same quality training. In conclusion, we hope that the university will continue to be open to continuous support supervision to help meet the ever-increasing need for improvements of training standards for health professionals in our country, especially in matters of public health. This will call for planned and impromptu visits, sharing of data, and collaboration on all areas of training. So as we give you full accreditation today, we are saying the council and the secretary, the registrar here, will have a right to walk in, see what the students are doing, how the students are being taken through, Were those equipments just put there for today, or they will continue being there for the improvement of our graduates? Because the graduates who churn in today, out today, tomorrow and the years after, they should actually be exposed almost to similar exposure at all levels. So the council will be able to come in the university and walk in even in any other campus other than Thika to ensure that the graduates are getting out in the right level of training. Finally, I wish to once again congratulate the entire university community and the Public Health Officers and Technicians Council for putting up the collaborative efforts to deliver program accreditation for Bachelor of Science and Environmental Health in Mount Kenya University, Thika main campus. And as I've said, we will continue to work with you, collaborate with you, our Vice Chancellor and the team in matters research. We mentioned a number of them as we walked around. And our commitment from the council is that we will partner in various areas. When we are saying that let's accredit, for example, the labs, we'll also recognize them. We'll also say we are working so that whatever comes out of this institution in matters science, in the areas that we had mentioned earlier, we are going to also to own it up and say those are facts that we can start with as a Public Health Council of our Republic. So thank you very much, and may God bless you for this achievement. Asante sana.
When in a class setup and the lecturer gives the marking scheme and you have scored 100 out of 100, you put on a brave smile and clap in a better way. Thank you so much. Indeed, we will work with you. It is my honor and privilege to welcome Madam Mary Kamau, the CEC in charge of health, Kiambu County, to make her speech. Kindly let's appreciate her as she comes on board.
Thank you, MC. The chief guest, Dr. Eva Jenga. I also recognize the presence of the Vice Chancellor, Professor Wundo. We are trying to fix things there on protocol issues because we are very conscious as state officers. So if we miss something, you'll forgive us. I recognize also Dr. Jonge. I recognize Mr. Simon Kimani and the registrar, and all the invited guests. Good morning. It's afternoon. Yeah, it's good afternoon. I am really honored to be here, and I also stand here on behalf of His Excellency the Governor. For him, he loves waving at people, so I'll try to fit into his shoes by waving at you like this. He uses some terms that, due to the environment and the mood you've put here, I will not use, but which I enjoy all the time. But before I give or present his speech, I wanted to make a few remarks as a CCM Health Services. Let me also clarify, people love calling us CEC, but because I'm dealing with the academicians, it's also good, maybe I train us something on the CEC and what really our title is. I'm the County Executive Committee member for health in Kiambu County. If you call me CEC, you are calling me a County Executive Committee. I hope that now clarifies, isn't it? So next time, you call them CECM. It may be mouthful, but that is the right thing to do it. I hope that one is clear. So as the CCM for health, I have some few comments before I talk or before my boss talks through me. There's one thing that we have observed, and I just pick one from one of an NCD center we've reached at Gatondo, level 5. And maybe in fact, before I talk, I want to recognize the presence of the level 5 Metsu. Dr. Nyaga, you can stand and do it the governor style. Yes. Who actually before he came to Thika level 5 was at Gatondo level 5. And I know he initiated some program where we have what we call a non-communicable disease center of excellence. Let me also recognize the presence of the Assistant Director Public Health, Mr. Muridi. You can also stand up and wave at the congregation. And by this, Professor Wood, we are making a statement. We are very excited to have this program coming on board. And going back to what I was saying, by having an NCD Center of Excellence at Gatondo Level 5, we used to have the bed occupancy in the inpatient wards at 120%. Because as you are all aware, most of our public facilities have this characteristic of having to overbook the patients. The other day somebody was asking me why we don't turn away some patients and tell them it's full. I don't know where we'll get that law to allow us to do that. There are people who are opting for that. If you go to some other facilities like Kiabu Level 5, we have a bed occupancy at 140%. It's just bad. But there's something that is phenomenal that happened at Gatondo Level 5. By having that NCD Center of Excellence, and I can tell you it's really functional, our bed occupancy today is at 60%. And I invite you, even the KBD chair, I invite you to go to Gatondo Level 5. I know that's your passion. You go and see the impact of focusing on primary health care. The impact of the small things we can do, and we reduce all the noise and the congestion we are having when you are dealing with curative and then of course to palliative health care. It is phenomenal. And that has actually caused me also to become very passionate about public health, about primary health care. I usually inform the people, I'm not, or we are not very happy to receive you when you're almost dying or when you're so sick. We wish you don't come to the hospitals at all. The doctors or the health service providers are getting overwhelmed. In Kiabu County, like we're saying, matters NCDs, I can assure you they are getting to some alarming levels. And it's a high time we engaged in this serious narrative, like one that we almost started. When you look at the food safety, our lifestyle and everything that we're doing, take it seriously before we have to, start dealing with the repercussions of not addressing this critical thing. And that is why we are saying, as a health department, we will be here to give you full support. At one time at one juncture, I said, we'll be willing to come and sign an MOU with this university so that we agree on how we work together on this. We are really excited. So from my office, we say congratulations, and we wish every other people to do this. I'll go on now and present what His Excellency the Governor wanted to stay, and he passed his apologies for not making it to this occasion. Dr. Jenga, the Vice Chancellor of Mount Kenya University, Professor Wond. We also have the Chairman, Mr. Simon Kamau, Kimani, and the Registrar. Ladies and gentlemen, and all invited guests, habari zenu. I feel honored to join you this morning as we celebrate this launch of the Mount Kenya University accreditation for the Bachelor of Science degree in Environmental Health. The county government of Kiabu is proud to mark this day with Mount Kenya University, as it will enhance the capacity for environmental health management, not only in this county, but even in the country at large. A healthy environment leads to better health. Sustainable Development Goals, that is SDG 3, seeks to ensure healthy lives and promote well-being for all ages. Specifically, target focuses on reducing illnesses and death caused by air, water, and soil contamination, as well as chemicals which are hazardous to health. According to the World Health Organization, the environmental burden of diseases in Kenya starts at 24%. To promote a healthy environment, we need to go beyond healthcare and work together with other development agencies and sectors such as agriculture, energy, trade, transport, and health to improve the environment where people live and work. The program we launched today will go a long way in growing the capacity in our country to deal with the environmental hazards, identify innovative methods to address emerging environmental issues such as climate change, the handling of electronic waste, land, and of course soil degradation, and the deforestation that has become part of this society. Ladies and gentlemen, my government is especially proud to partner, and I have been involved in this development with Mount Kenya University. The university is a key stakeholder for the county, and we work closely together in education, health, and also in research sector. As we celebrate this day with Mount Kenya University, I pledge and commit myself to strengthen and grow our partnership and collaboration for a better future for Kiambu County and the country of Kenya. Today we congratulate and celebrate Mount Kenya University on this great achievement. Hongera. Asanteni sana. God bless Mount Kenya University. God bless Kiambu County. God bless Kenya. Thank you.
Thank you. Let's appreciate her once more. Kindly, Madam CECM, I will still request you to do the honors of inviting the chief guest to grace and give her maiden speech. Kindly.
Sorry, I forgot that one. I think it had been mentioned to me. It happens when you are not very much psychologically prepared for some of these things. But it's my single honor to invite Madam or Dr. Eva Jenga. I'm used to interacting with her when she's coming to supervise and see how things are. But I'm happy today we were dining together. So welcome. Thank you.
Good afternoon. Thank you, Madam Mary Kamau, Chief Executive Committee Member of Health. I must say it right, I can't say it wrong. So the Chairman and Founder of Mount Kenya University, University Council members, the Vice Chancellor, Management and staff of Mount Kenya University, the Chairman and Board of Public Health Officers and Technicians Council, the Registrar and staff of the Public Health Officers and Technicians Council, the heads of academic and administrative units of university, distinguished guests, students, ladies and gentlemen. Again, good afternoon. You've been told my name is Eva Jenga, but I'm here as representing our cabinet secretary who really wanted to come, even as late as yesterday, but due to unavoidable other commitments, she sent me. But I'm so happy I was sent. Vice Chancellor, I told you earlier, I have a history with Mount Kenya. Before I read her speech, because once I read, I won't add anything. Let me just say a few things. I am really, really happy I was given this opportunity. And you can even tell my enthusiasm by what time I came. This university speaks a lot to me. When people started writing something about your medical school, I was somehow involved in the background, having been very active in Non-Communicable Disease Society, where I share. So you can also call me an activist. So I really work to try and mobilize people about prevention of non-communicable diseases through lifestyle change. I was somehow engaged in as they were writing grants for the medical school. So I'm really happy to see that you are being also pioneers of a department which I hold key when it comes to prevention of not just communicable diseases, but NCDs as well, non-communicable diseases. And as Madam Kamau said, if you address that aspect, you can actually reduce that burden of both communicable and non-communicable and reduce the bed occupancy. We always cry, Kenyatta is full, we need to decongest, Kiambu is full, you've just said that. Anywhere, you go to any of the public hospitals, level 5s, patients, we get in paper, social media are very good at saying this hospital can't cope, 3 patients in a bed. If we take that role, and I must say congratulations. Congratulations, Madam Kamau. Honestly, you said that and my heart skipped a few beats, and I'm definitely coming to Gatodo, because that's something. And Dr. Nyaga, really, you had heard in that. When you talk about centers of excellence, it's not just by word. I would like to come at that impact, which is measurable. You've said from 120 to 60%. That should go into the bank. Anybody should write that. The social media that writes telling so many things, I mean, these are positive things to pick from our county governments, what they are doing. And we shouldn't go anywhere else to benchmark. I would say everybody to go and benchmark in Gatodo, because that is something I'm really passionate about. And what we are launching today, or we are accrediting today, is going to go very far in making sure that our hospitals are not burdened by just curative issues. We are going more into preventive and making our population healthier. And we only do that if we work together and if we speak to each other. I come also from the regulatory board, that's the council, and I see my colleagues here. Unless we talk to each other, you will go and regulate Kiambu, I'll go and regulate Kiambu, you come after me, wastage of time and energy, and then we write reports that end up being shelved. If we go as a team, we will come out with useful reports that will be able to help the community or the people we are trying to regulate. I suggest, and I'm suggesting this both as the chair of the Regulatory Council and also as the NCD chair, most stakeholders interaction and collaboration is the only way to go in this country. And not just in health, even in other sectors of development, so that we can save our country much needed economy and we can develop. We keep on talking about the Big Four agenda. It will not happen until we work together. We've talked about rolling UHC in 2030. UHC 2030 will not happen without primary health care. So those two must be conjoined. So we must work together. So this is why public health officers and technicians, you're going to play a very big role in achieving the 2030 agenda of the UHC. So that's really a passion, and I will stop being an activist and attempt to fill in the shoes of my CS. She is really a very passionate person when it comes to these deliverables, and what the thing she is after is looking at other health professionals that will help, not just people who call themselves doctors like me, but public health officers, clinical officers, nurses, community health extension workers, and even community health volunteers. We work together, we will achieve our goal. So let me read her speech to you, and those will be my very brief remarks as I aim, and I will remind you, I'm coming to Gatodo. I'm very excited. So without that, members, this is what your cabinet secretary says. It gives me great pleasure to join you at this occasion, mental health program at Mount Kenya University. On behalf of the Ministry of Health, I wish to congratulate the leadership of Mount Kenya University on this achievement. The role of environmental health in the prevention of illness and promotion of well-being cannot be gainsaid, as 16% of global disease burden is attributable to environmental health issues. This calls for a greater focus on the quality of training, which I'm hoping, Professor Oudo, that's what you are focusing on and your team, adequate numbers of health professionals, and skills set mix. So we are not just getting numbers, and this was alluded to earlier, we are getting quality skills. And we hope with that we will be providing continuous professional development as a vital component of human resource for health. So ladies and gentlemen, through the statutory regulatory boards and councils, the Ministry has continually conducted regulation of training and practice to develop a competent, responsive, and highly skilled health workforce that will deliver quality, accessible, and affordable health care to all Kenyans in line with our Constitution. Let me pause here and say, I'm in the Medical Council, which was a board. Professor Magoha, my previous chair, was among the team that came to inspect Mount Kenya University when you're setting up your medical school, and I was a member of his board. And it's very rare, you know the rights of Professor Magoha, it's very rare to have him give people a compliment. He came back and he said, my colleagues, that is a university we must emulate. That's a medical school that has been well thought out, and we think it will give quality to outputs as far as the professionals are concerned. So I just hope that as I come back to inspect you, maybe before I exit as a chair, I'll have the pressure of saying the same. Because on the things he reckons, every time you've been a benchmark for some of the new upcoming private medical schools. So I'm really, really pleased about what I've seen today. And going around today, I was very pleased. The public health officers trained by this university will form a critical component of the skilled health workforce in Kenya. Public health officers training have a direct role in addressing food safety, like the recent red alert. And I know, Dr. Basho, you will be talking maybe to the media later about this red alert. Was it just a panic alert? Was it real? Do we have anything to worry about? So, and new students, please, we went through your laboratory. You really have everything. You must come out. And you're not just going to do this for this region, for Thika. You've said, I think I see your mission, it's to provide, you're thinking not just in Kenya, but in Africa. So you have a big task. And being the first and pioneers, people will be looking up to you, all right? So the officers will address the health challenges posed by tobacco use, tobacco products, and the disease outcomes such as cancers and respiratory infections, just to mention a few. So ladies and gentlemen, every public health officer and technician practicing in Kenya must be registered and licensed to the Public Health Officers and Technicians Council of Kenya as stipulated in the Public Health Officers Training, Registration and Licensing. We have, that is Act number 12. This was formed in 2013. The council is also vested with the mandate of regulatory purposes. So I'm hoping Registrar and Chair, we're going to make sure you make sporadic and announced regulatory visits. Because sometimes, as someone said, maybe those big, nice machines and very well-dressed people were set there for our tour this morning. So we will make impromptu, I'm sure they will make impromptu visits that we do, like we do in some of our health institutions. And sometimes you get shocked at what you find. But I'm sure Mount Kenya University, you have to live up to your name. You can't disappoint us. Today's ceremony, therefore, marks an important milestone in compliance with the regulation of training standards for public health officers and technicians in Kenya. I am glad to report that the Public Health Officers and Technicians Council has inspected the Mount Kenya University, the main campus, and has met the requirements of accreditation to train public health officers at a degree level. And it is my hope that the university will continually improve the standards of training in partnership with the public health officers and technicians council in pursuit of skilled public health officers and technicians in the country. Moreover, I expect the council, and I've seen the council, to provide a supportive role to the university in moving forward so that we don't just stop at degree level. We should go to PhD and so on and so forth. All right? And for you students, let me tell you, don't wait for money to flow for you to get sponsorship. Write research grants. There's so much money around for research. And I have been to universities whereby lecturers are not paid any money by the university. You write your own grants, and that's where your salary comes from. That happens all over the world, in all the international universities. So can we start that trade here? We write grants, we bring money to the university, because we talk about funding. Don't look out there. Let's look from within, write our own grants, and then that research will inform the kind of information we talked about as we went on tour. So please, let's start this and bring money to this university for a very noble cause. Now, I challenge this university to replicate compliance at the main campus, all the other learning centers and satellite campuses offering programs in environmental health. And even those who are not offering environmental health would like to emulate you and even to become envious because of the graduates you said out there, because they'll make a change in the lives of Kenyans. I urge the Council, Mount Kenya University, and all other stakeholders to guarantee potential employers for this competent workforce while assuring that the public quality of public health services is delivered. On its part, the national government will continue to provide enabling environment and policy to support health workers training in Kenya. Through collaboration with the county governments, we continue to provide practicum and internship facilities in our hospitals. Finally, ladies and gentlemen, it is now my singular honor to request the Vice Chancellor of Mount Kenya University to step forward and receive the accreditation certificate on behalf of Mount Kenya University.
Yes. Wonderful. What have you been waiting for? We do it in a special way. 3, 2, 1.
The Bible says it's a good thing to give thanks to the Lord. Amen. I come before you today, and there's just one thing that I want to say. Thank you, Lord. Thank you, Lord, for all you've given to me, for all the blessings that I cannot see. Thank you, Lord. Thank you, Lord. With a grateful heart, with a song of praise, with an outstretched arm, I will bless your name. Thank you, Lord. I just want to thank you, Lord. Thank you, Lord. I just want to thank you, Lord. Thank you, Lord.
Mount Kenya University, unlocking infinite possibilities. My university, my choice, my pride, my affordable education.
Thank you, Lord. You took my sin and my shame. You took my sickness and healed all my pain. Thank you, Lord. Thank you, Lord. With a grateful heart, with a song of praise, with an outstretched arm, I will bless your name and thank you, Lord. I just want to thank you.